The Nursing Research Council did a survey of nurses, and an overwhelming theme was education was lacking for research. So we developed, if you will, a 101 for nursing research, which kind of takes you from the start of a project, a question, to actually finalizing that. And it can be for any nurse to better understand research or to actually do their own project.
In my role as clinical program coordinator for nursing research, part of what I do is to help nurses with research and evidence-based practice. Well, we did draw on the larger nursing community for the subcommittee, which we thought was important to expand beyond just the Nursing Research Council. The 10 sessions were designed around the structure of a nursing research textbook, so a whole nursing research course, but then modified it to be more relevant to the clinical audience. And then we worked with the faculty to also modify those objectives so they would be relevant for clinicians.
I think we came to this determination that education would be a good first step in educating the nurses and using real-life clinical explanations about the research. I think brought in a little bit more life to it rather than such a dry topic as some may envision research to be.
A lot of the faculty were nurses who were actively involved in research or who supported research, but then we also had faculty who were PhD prepared researchers who worked, non-nurses, but who worked in the clinical areas. So they all had clinical connections, so all of their examples and stories were related to clinical issues. Part of what the Research Academy has been able to do is, I think, sort of demystifying the research process, I think, for people. One of the unique things that we did for this development of the program was not to have one faculty person teach the whole course. So I think that was a refreshing thing. Staff got to see a whole bunch of people who were doing research instead of having one teacher standing there giving a lecture for 10 sessions. The first session was getting started with research, so an overview of research and the history of research. The next one was how to ask a question, how to look at your clinical practice and come up with a question. And so from there we went to study design. So when you have your question, how do you design your study? Do you go the qualitative route or the quantitative route, depending on your question? And then we had analysis of your data, how to analyze or how to conduct a data analysis plan, how to analyze your data. And then the final session was how to disseminate your findings. So we had a session on writing for publication or presenting an abstract. So we went the whole series from starting with your question to then publishing your results and sharing your findings. I think nurses are very interested in examining their practice. I think people will start to see that the resources are there for them, that it's developing infrastructure, but also a level of interest, I think. The Research Council is now planning on doing sort of Research Academy 2, and, but it will be a different slant this time. It will be focused on evidence-based practice, and it will be applying that research to the bedside in a more specific way. We will be putting together another subcommittee to help us, but it will be using the latest research and people who have implemented research in their practice, but using targeted clinical issues that the organization is facing or that nursing is facing, such as pressure ulcers, pressure ulcer prevention. So that may be one of the topics that we tackle. We've had several different groups that have been interested. The NIA hospitals are interested in having their nurses access, and they can through DH video, the whole session, the whole series of sessions, and so that will be throughout the NIA organization.
I was interested in the Research Council initially because I feel that in my own practice, maybe I'm rather inquisitive, and I try to make sure that I am doing the best for the patient with using the most evidence-based practice.
It was a big project. There was a lot of complexities, but the council did a fabulous job of putting it together, and I think it's something that they are proud of.